Millions of people continue to die each year as a result of AIDS, and millions more contract HIV, and no cure is imminent. While treatment and prevention techniques for HIV and AIDS have improved immensely over the last 25 years, there is still much work yet to be done before scientists produce a vaccine that is effective and affordable. In this presentation, I'm going to explain what HIV does to the body, what the prevention techniques are to prevent the spreading of HIV, and why a cure for AIDS is so difficult to find. Effects of HIV on the body are that the virus enters the body and attempts quickly to kill all white blood cells in the immune system and in the blood. Non-HIV infected individuals have as many as 1,200 white blood cells per 1 millimeter of blood, whereas individuals that have been infected by HIV have as little as 250 white blood vessels for the same measure of blood, 1 millimeter. This is according to WebMD, published this year in 2009. Once the immune system is weak, then the body is vulnerable to diseases and other infections. It has difficulty fighting off any of these assailants to the body. Opportunistic infections target the body as a host, and opportunistic infections attack all organs, and the immune system isn't able to stop it. Opportunistic infections are infections that typically the body is not weakened by. They can't typically penetrate the body, but when the HIV virus is killed, most of the white blood cells in these infections can enter the body and attempt to kill the organs vital to the body's survival. And again, this is according to WebMD, published 2009. In order to prevent the spread of HIV, it's important to help alter social behavior. The three top methods of the spreading of AIDS are through male-to-male sexual contact, high-risk sexual activity, and intravenous drug users sharing needles. All three of these are social behaviors, and all three can be prevented through education and other means. This is all according to the CDC in a report published in 2008, and UNAIDS, also a report published in 2008. By encouraging the alteration of sexual behavior, by encouraging such things as abstinence and monogamy, we can reduce the instance of transmission of AIDS. We also need to encourage the use of condoms where alteration of sexual behavior is unrealistic or rejected. And we also need to help intravenous drug users overcome their addiction or to use clean needles to help prevent the spread of HIV. Finding a cure for AIDS has been very difficult. Much progress has been made, but the virus mutates at an incredible speed. It creates numerous varieties of strains. As soon as a treatment or medicine begins to be effective in helping combat the virus, then the virus mutates, changes, and makes sure that it can get around the treatment or the medicine. This is according to the IAVI, the report written in 2009. It's difficult to find a vaccine that can combat all variations and strains of the virus. Most vaccines boost the immune system, and most viruses attack something other than the immune system. HIV specifically targets the immune system for destruction. This makes it especially difficult to find a vaccine that can help combat the HIV virus, because the very system it is attempting to boost is the system that's being destroyed by the virus. Considering the difficulties that scientists face, there's actually been tremendous progress overall in the context of history and scientists creating vaccines to battle viruses. Again, this is according to IAVI in a report from 2009. It took decades for the vaccines for smallpox and chickenpox to become available to individuals to prevent the spread of those viruses. And we're actually quite far along in the search for a vaccine for AIDS. This is a graphical representation of the number of individuals in the world that have AIDS and that are affected with the HIV virus is a percentage of the density of population. There's a copy there in your packet that I handed out earlier. Can you see this all right?
Yes.
The darker the color, the higher the density. So this was published by the World Health Organization in 2007, and it represents the 39.5 million individuals in the world that were infected by the HIV virus in 2006. So here we can see in the countries in the southern tip of the African continent have the highest density, represented by about 15 to 34% of the population that's infected. And then the lighter the country, The lightest ones represent 1/10 of 1% of the population that's infected. Here in the United States, we have an infection rate of approximately 1/2 to 1% of all individuals that are affected or infected, by the HIV virus. A cure for AIDS is not imminent, and it will be difficult to find, and millions continue to suffer. AIDS is a very difficult and complex issue for the scientific community to solve, but treatment and research has improved rapidly over the last 25 years. There yet remains much work to do before scientists produce a vaccine that is effective and affordable. But in the meantime, we must focus our efforts on prevention. Are there any questions?
Yes.
Go ahead.
How many people die from complications related to AIDS each year?
Approximately 2 million, according to UNAIDS in a report that was published in 2008.
Have any tests, vaccines been proven effective?
Yes. In October 2009, a clinical trial for a candidate vaccine called RV144 showed the vaccine to be 30% effective in preventing HIV infection, according to the United States military HIVRP, a report that was published in 2009.
Is it true that gay men face a greater risk of contracting HIV as heterosexual men?
Yes, that's true. Approximately 1/2 of all instances of the transmission of the HIV virus is a result of male-to-male sexual contact, according to the CDC in a report given in 2008.
Right.
That's all the questions?
Yes.
Thank you.